We all know conjunctiva is a mucous membrane that lines the eye as well as the lids. So, especially in surface over this cornea, there is absence of conjunctiva. In the other areas we have, there is inflammation of conjunctiva is conjunctivitis. So, there is bulbar conjunctiva is that part of conjunctiva which lies over the eye, the globe. Whereas a part of conjunctiva that lies over the eyelid is called as a palpebral conjunctiva or the tarsal conjunctiva. Now, physician is going to do a repair of conjunctiva which is called as conjunctivoplasty, and this can be done by the cul-de-sac and the buccal mucous membrane. Okay. Next is Symblepharon. Now, what happens in a Symblepharon is that there is complete or partial adhesion of the palpebral conjunctiva to bulbar conjunctiva. So, we all have, you don't have to know the exact diagnosis of the medical conditions of all these procedures. Just figure out what the condition is, go to that particular condition and select the types of repair that are being performed for these treatment of these conditions.